Okay, well, joining me once again to discuss the situation in Quebec is Dr. Emily McDonald. She's an associate professor of medicine at McGill University and an internal medicine specialist and epidemiologist. So, Dr. McDonald, thank you so much for making some more time for us. I want to get right to it here. Of course, the major development is that Quebec is going to allow healthcare workers to stay on the job in certain circumstances, even if they test positive for COVID-19. Is that a solution, or is that just another problem, in your view?
Yeah, that's a really interesting question. Bringing healthcare workers back to the hospital who have tested positive is a measure that I don't think the ministry is taking lightly. The message that we got was that they had sought a lot of counsel, that they had talked this over a lot, gotten a lot of people's opinions, and that they felt that they had no choice because the number of absent healthcare workers is projected to rise to about 10,000 workers over the next day or so. With that said, it's a new solution that I have some concerns about. I can imagine a scenario whereby everything is very controlled and you bring back a healthcare worker who tested positive into the hospital and they have adequate protection and everything is set up so that they have a space to eat, a space to go to the bathroom, so that they minimize contact with other workers. And that's a very controlled situation. But in reality, sometimes in the hospital, things aren't as controlled as we imagine them to be. Things can be hectic. People are tired, especially if you're sick or maybe you have minimal symptoms, but you're wondering, am I feeling symptomatic or not? You may not be at your best. So I can see ways where it could break down. So it worries me a little bit. Maybe in 10 days, we're going to see that it works out well, but maybe in 10 days, we're going to see that it leads to actually more positive cases.
And obviously, I don't wish this on you, but what if you tested positive? How would you feel about this going to work in a hospital ward?
Yeah, it was something that I was thinking about during the announcement. There are people who, first of all, will be worried that they may come in contact with a case. We already worry about that when we're going to work. We want to make sure that we're adequately protected. The added stress, if I were to have COVID, to protect my patients from myself now and to protect my colleagues, that weighs on me. I would be worried about that, and it would make a stressful job more difficult to do, if I could say.
So we heard some data there from Health Minister Christian Dubé. He said he'd been reviewing this and that the rate of cases requiring intensive care is not where it was earlier this year. So what should we be watching more closely? Patients in the ICU or those overall hospitalizations?
So what they spoke about was a ratio. They said that, for every 10 people who are hospitalized with COVID, we're seeing one person in the ICU. And that ratio is important because it shows us that maybe there's less severity than other variants, but the absolute numbers are also really important. So even if the ratio is less, like you have 10 people in the hospital and one goes to the ICU, if you have 1,000 people in the hospital, that's still a lot more people going to the ICU than previously. So that ratio is interesting. And, they did say we want to take some good news where we see it, but we still need to remember that if the absolute number of cases is really, really high, even if the ratio is lower, we still only have a certain amount of capacity to look after people in the intensive care unit.
So one of the things that we heard there about part of their rationale for this is that there are nearly 8,000 healthcare workers not at work right now because of COVID, and that they're worried they're going to get to this point where they can only provide critical care in hospitals and everything else would be postponed. How close are we in reality to actually getting there?
Honestly, I don't know how close we are, if we're a day away or a week away. I think that it must be at a critical situation for the ministry to be considering bringing back healthcare workers who have tested positive. So, whether or not that is something that they see happening in a day or 10 days from now, it's clearly close enough that it's a major concern that you would bring back workers who are testing positive.
Okay, and I've got about a minute left here. I want to get your opinion on something else that we heard there, saying that they are looking at what is happening south of the border. So, of course, the CDC has come out and said that they're going to shorten that isolation period for people who have tested positive from 10 days down to 5. What we heard is that they are reviewing that. What do you make of that? Do you think that that is something that Quebec should be considering right now, given this situation, or are they sort of out of options at this point?
No, I do think that we should be considering that. And in a way, that was almost an intermediary step to me before bringing back people who have tested positive. Start by bringing back people who are asymptomatic who test negative at 5 days. Even, the situation that they presented where if you've been exposed, you self-monitor and you test daily. That also, I could see that being a means of bringing back healthcare workers earlier. I do think that would be a good measure to look into putting into place because to me, that's a little bit more controlled. And there are studies showing that, a lot of people who have been exposed after about 5 to 7 days, if they're testing negative, it's fairly safe to bring them back and that they're much less likely to infect others.
Dr. Emily McDonald, we really appreciate you sticking with us, coming back a second time, and helping us to make some sense of what we've heard today. Thank you for your time.
Thank you. Bye.
Dr. Emily McDonald is an associate professor of medicine at McGill University in Montreal.